Okay. Hello, family. It is Mrs. Day all day, and I am coming back. I just finished my live stream today, but I'm not live in this doing a live stream on this one right now. I am actually recording, but I could not rest and go to bed this evening without getting this off my chest because, as I mentioned, I'm going to get more regular. I'm going to go live 2 to 3 times a week, but there are a lot of situations and buffoonery and fuckery that is going on in the world right now. And I'm feeling compelled to speak on it. And like I say, I'm not perfect. I'm in a press. I will share with you guys about everything later. But right now, we're going to talk about Dr. Jackie from Married to Medicine and that foolishness and that buffoonery that she spoke on, because I have a personal experience with being dismissed by a physician. And that what she did, it wasn't okay. But I need you guys to know, like I said, I have a good relationship with God. I'm not in religion anymore. I'm in relationship with him. And he's yet purging me. He's helping me. At one time, guys, believe it or not, I had stopped cussing. But yeah, these next few days, I'm going to get a lot of these opinions that I have. This is my opinion. This is what I'm feeling and what I think needs to be spoken on. I'm going to deal with it. And one of my favorite passages of scripture is Esther, because I am Queen Esther, okay? I am Esther. And the Spirit of the Lord told me that verse 4 and 14. Let me share it with you guys. This is the word. For if thou altogether holdest thy peace at this time, then shall their enlargement and deliverance arise to the Jews from another place. But thou and thy father's house, that's me and you, right? But thou and thy father's house shall be destroyed. And who knoweth whether thou art come to the kingdom for such a time as this? Now, let me say this again, because this is about when you know you are to speak out about something, but you're just holding your peace. You don't want to offend. You don't want to say anything. And I know how people say you shouldn't speak on politics and religion, but those are the two that are scorching the earth right now. So, again, let me say that verse 4 and 14 in the book of Esther. 4 and 14. And 4 is my favorite number. For if thou altogether holdest thy peace at this time, then shall their enlargement and deliverance arise to the Jews from another place. But thou and thy father's house shall be destroyed. Who? But thou and thy father's house shall be destroyed. And who knoweth whether thou art come to the kingdom for such a time as this? And what I feel in my spirit is that I have been preserved for the kingdom for such a time as this. Because y'all know my history. I could have been gone a long time ago after the brain tumor, any of them 2 bouts of breast cancer. One of them was last summer. My heart could have been broken. I could have been a lot. But God has preserved me for such a time as this. And when I heard and saw with my own eyes, let me back up a minute. Before I even saw this buffoonery and this foolishness, because I could have said fuckery, this foolishness that Jackie from Married to Medicine was on and what she said, let me back it up a minute. I was on the YouTube because you know I have a YouTube channel, Mrs. Day All Day. Please click and subscribe, turn on your notification bells because we going all in this year of 2024. We gonna be better because if you the whole goal and the purpose is to be better today than we were yesterday. Get our businesses up, get legaled up, and let's take care of business. But as I was saying, a while back, I was on YouTube and I came across a video. There was a beautiful queen, a sister. I wish I could insert it here, but I'm going to get better on the editing. My husband is a great editor, and we will put these things in. But that's neither here nor there. I'm not going to keep waiting in order to do something because it's not quite perfect. Okay. But this sister was in a doctor's office. She was in there, I guess, with the nurse practitioner, and she was a Karen. Okay. So Karen is in the office with her. She's 7 or 8 months pregnant. She was experiencing pain. And she was asking for something to assist her to relieve this pain she was going through. The nurse practitioner, the Karen, was telling her no and denying her. So she asked to speak to her doctor. She said, "Can I speak with the doctor?" When she got a hold of the doctor said to her, understood her pain and respected her request and granted her some form of medication. Whatever she could take during the pregnancy, whatever it was, the doctor respected her request. So when the nurse practitioner comes back in the room, she's now angry. Did you hear what I said? The nurse practitioner is angry because the doctor, let me calm down. See, I'm getting vexed in my spirit right now, just as I'm recalling this video. The nurse practitioner was vexed because the doctor granted the Queen Nubian's request, right? So now she's like, "Yeah, whatever. You're always complaining and asking for something." And the sister was like, now she pulled out her phone. That's how the recording started, because she can feel this aggression from Karen because she's mad because she has been granted pain medication in her 8th month of pregnancy. So now, not only did this bitch, I'm gonna call her what she is, the bitch Karen now is furious and she's antagonizing the queen. She mad because now she's recording this aggression. Do you know that this demon had a laptop or some kind of notebook pad, and she went to swinging and hit the queen with the patient, the pregnant patient, walloped her across her arm, was aiming for her face, but the sister put her arm up and hit her with the computer. Now, see, I'm gonna just keep it 100. Let's just keep it a buck. She would not have gotten through that day if she would have did that to me. Because see, I'm legal, I'm licensed, and nobody's gonna assault me. That was an absolute assault. She would have suffered some consequences for that action, for whacking the pregnant mom with a laptop. But see, a black woman, I don't believe she would have did that to a white woman. Let's just keep it a buck. I'm gonna try to follow up. This was on TYT with Dr. Richie's program because he has so many great stories. Positive, he shows the negative, he shows everything. Dr. Richie, indisputable. If you guys don't know, tap in. But that Karen wouldn't have got away with that. She would have caught hands. Well, I would have stumped her with the Timberlands first, tried to mace her. If she was still been moving, then she would have caught one. So I'm when I saw that, I was so appalled that a person that was supposed to be sworn to help, I don't know if doctors and nurses take the same oath, the Hippocratic oath to not harm, but you had the audacity to hit me with a laptop because I asked for pain medication. Oh, you would have caught it that day. You would have met your reckoning. You wouldn't have got away with that. So, okay, let's fast forward. I don't know how that ended up. And then I think the hospital where she was being treated, they were trying to do the two-step shuffle. They was going back and forth doing that whole little Bobo thing, trying to justify what happened. But that demon should have been arrested for assault, dismissed from her job as in fired, and then I would have placed a lawsuit against her and the facility. That's why I'm legaled up. I have legal shield. Okay, so and access to an attorney. Okay, let me calm it down. Now that was the first part. So I had saw that. And then I had already been hearing how physicians are going in on Black women, Black folks in general. We ought to be able to endure pain. We're just faking it. We're trying to get meds. And that's just what it is. They're not doing anything else. We just want drugs. Well, the devil is a damn lie, because some of us, that's not the case. Some of us are not trying to do that. I understand you got people out here on opioids and all kind of drugs, but hey, I see some white ones strung out too. This is not just a Black situation. Okay, so let me fast forward. Let me keep it moving because I'm at 9 minutes now. I'm gonna wrap it up. But here was the deal. This is why this pissed me off to the nth degree. I am, like I mentioned to you guys earlier, I'm a two-time breast cancer survivor. So this past summer in 2023, I was diagnosed with breast cancer. I was like, okay, I know God has got me. I have strong faith. And so as I'm going out, I'm out here in Nevada, and I go to the cancer care center, and I end up getting introduced. One of my doctors, he wasn't available, so I get another doctor. So happened that she was the cancer care specialist, honey. This doctor was in charge of the cancer care center. So I was like, oh my, look at God. So when I go in to meet her that day, if you go back on some of my videos, you'll see I'm praising her. I said her name. I'm all excited about it. Yada, yada. God, look how God blessed me with this physician. But at any rate, when I went in to meet her that day, even when I saw her in the profile of everything, I saw her face, right? And I saw her. And it looks like sis may have had Bell palsy, something may be going on. I didn't know if it was a stroke, right? But I wasn't judging her when I met her. I went in there with my little diamond bling mask, my queen mask. I had it on. So when I go in to meet her, I'm saying to her, oh my goodness, I just read your bio. So nice to meet you. And she's looking at me saying, oh my God, nice to meet you, Queen. She sounds like she might have been Russian, had a Russian accent. And oh, it's good to meet you as well, Queen. Okay, so she's calling me the Queen. I'm calling her a boss because, like I said, I had read her whole bio, right? And talking about who she is. Oh, I shouldn't have showed her name. But anyway, I was excited. So, like, let's move forward. When I go get my pictures and everything done, I was get because I'm a former government employee. I had Blue Cross Blue Shield. Praise God that I have some insurance because I know some of my brothers and sisters out here right now are uninsured. While we giving billions of dollars to other countries, there are some of us that are not insured. Okay, I'll park that car to another day because my husband is a veteran. We gonna come up on this on another day. So we were talking. So we went to go get pictures. I went and took pictures, mammograms, whatnot. And I'm thinking previously 12 years ago, breast cancer on the left side. So now we taking pictures on both. After the pandemic, the Lord would say, go get your test. Because I didn't do anything during the pandemic. I didn't want to be in no doctor's office. I didn't want any parts of it. So now, and if you guys see my eyes shifting, I'm looking up here to give you eye contact. I'll be looking over here, seeing my big head in the camera. Okay, so when I go to get this breast mammogram done, they call me back and say, we see something. That's how I ended up in her office, right? So those pictures were taken. They came back, told me to come in and see her, got the pictures. She said to me, I can see, oh, I see something here, but I can see why they were telling me to maybe, they were saying something's here, but you know what? We can just watch it for the next 6 months and see what it says. And but I don't think it's anything. In my spirit, I can hear the Holy Ghost saying to me, we don't watch disease. I don't watch anything grow. And sidebar, my mother was a registered nurse for 28 years. She was the one that had gave me the advice that had them to find the brain tumor that was growing in my head for 6 months. Telling me to get an MRI and an MRA. They thought it was sinus infection, all kind of mess. So anyway, I've learned how to advocate for myself. So that if you don't get anything else out of this video, advocate for yourself. I don't care what somebody else is saying, how they trying to move you along. You got right. Okay. So she says to me, we ought to just watch it for the next 6 months. I got Blue Cross Blue Shield, y'all, that I paid 200 some odd dollars every month. Praise God, I got it. 260 some dollars, I think, a month. And yeah, okay. So she says, let's watch it. I hear in my spirit, we don't watch disease. So I said, you know what? I don't think so. I think I would go ahead and rather go ahead and take that nuclear mammogram. That's what was on the table. Get a nuclear mammogram or let's watch it for 6 months. I said, no, let's go ahead and take that test. I think I'll feel more comfortable with that. I'm advocating. See, I advocate for myself. Okay. Nobody gonna tell me watch some disease grow. We're not doing any of that. So we go ahead, we get in here, and I go off to the desert radiology to go get a nuclear mammogram. I get that done. So now it's time to go back to her office, okay, to go get the results. When she walks in that day, she's looking like she's lost her firstborn or something's going on. And I'm watching her face, and she says, "You know what?" She's throwing the slides up on the board. You know how they throw them up on the thing so you can watch it. She says, "Oh, hmm, it looks like it's cancer." I said, "Real?" I said, "Oh, damn." That's what I said. "Oh, damn." I said, "Wow, okay." So now she got it up on the board. So I jumped down off the table so I can get a better look. Okay, what we dealing with? Well, this is what's going on. We can go in here and I can go in and I can go get it out. Because, she's the best surgeon in Nevada and at UNLV all around the valley. She's it. She tells me, though, she said, "We can go in now. I can do it on an outpatient. I can cut this out." And I'm telling you, I got pictures of everything, of all of it, shows the lump sitting right here. This is the right breast. It's on this side now. But it shocked me because I thought it would have been the reoccurrence on the left, but now it's the right side. She throw the pictures up there and she says, "I can go in there and get it. I can do it on an outpatient." She giving me all the details now, right? And I'm looking at her like, okay. Then she says, "But it is at a stage 0." Now, I don't know how many of you guys and girls knew about this, but I didn't know cancer came at a stage 0. But I was grateful to God. That's why, like I say, I'm so grateful, and God has preserved me. The first bout, it was a stage 1. This bout now is a stage 0. Okay, what we gonna do? Let's go get it. So now we setting it up. Okay, and it's not even that serious. This was they diagnosed me in August of 2023. I think I came back to the final results in September after we saw them pictures, and we setting a surgery date for November 9th. Okay. And I asked them, "Do we need to be waiting till November?" Yes, because it's a stage 0, not that serious. Okay. But I say all this, guys, because I got to get to this point because I needed to let you know who my God is first and how he took me through that. And he gave me the wherewithal. I ain't gonna even say the audacity, but the energy and the knowledge to question when you got physicians telling you, "Let's wait." We're not waiting on nothing. I'll wait on the Lord for a word, but I ain't waiting on nothing when it comes to disease. So now we get back out here. We say a stage 0. Let's do the outpatient. We do it. We do the surgery. My husband with their ride to life. We get it done. I'm going through all of my stuff. All of that stuff that you see posted on my Facebook, which is Denise Day, or my Instagram, which is Mrs. Day All Day. When I got those boots on, when I'm at the surgery center, I'm counting it down. This was after surgery. I had to do 30 sessions of radiation, all of that, right? But now, immediately following this, that's what this was about. That I'm walking through. Yea, though I walk through the valley of the shadow of death, I'm fearing no evil. Get in Psalm 23 and talk about it. He didn't say lay down and die. He said keep walking. But now this brings me back to Dr. Jackie and her raggedy ass, okay? Because I got a couple of notes here that I'm going to share about her. But when I went back to Homegirl 4 days after I had surgery, after I had saw sister being hidden with a laptop when she was pregnant, just asking for relief and pain medication. See, they want to, and some of them, they can be white physicians, Russians, Iranians, whatever. But to have a black doctor talking this trash about a queen and of black women, that's where I'm drawing the line. Because see, I'm Esther and I'm gonna speak out. But okay, here we go. When I went back to her to talk about after surgery, I'm gonna have my husband, before I post it, I'm gonna have insert a photo of what it looked like, because under this arm I had two 2-inch scars. One where they took the the lymph node out of to test, because they got to test your lymph nodes and be sure that you don't have cancer in the lymph node. And then the second scar where she went in there and got it out, that scars and surgeries, and she had a stitch in there, supposed to be self-dissolving stitches, but one was raised up. That stitch in the boob was scratching under my arm. Now that was irritating enough. And Yep, in addition to me having pure pain from two-inch scars and pain going on. They gave me 3 days worth of pain medication. Or was it four? Might have been, I'm not going to even exaggerate. Could have been 4 days worth of pain medication. So when I called their office, called them back to tell them I'm in excruciating pain, could you refill my prescription? They had a Karen assistant. I'm going to just call her Karen because I ain't going to put her on blast. Her first initial is L. But L, the Karen, started getting smart with me, telling me that most patients, I don't care what's going on with most patients are doing better by day 4, and they don't need to give extra pain medication. The fuck? Now, I had to explain to Karen, I'm not most patients. I don't know, and I'm not concerned with most of your patients. I'm talking about Mrs. Day, Denise. I'm talking about me. And I'm not trying to jack anybody for pain medications, but I got a scar, a scratch from this stitch, and I am in pain. I could not even sleep, guys. I was up in the night. So once, okay, let me bring it down a notch. Ooh, when I think about it. I had to explain to her that I'm not most of your patients. I don't know who they are. But what I know for sure, one thing for certain, two things for sure, I need to speak to the doctor. So when I say, give me another appointment so I can get in there and see the doctor. So when I go back in there to go see her, do you know that she was telling me that normally most of the patients, same thing that Karen was regurgitating, L Karen was regurgitating, that most of the patients are fine after a few days. They don't need any more pain medication. We've had situations where I could give a squirrel's nuts about what other patients were going through in that moment. And when I went in there that day, I didn't have my bag with me. I didn't have my phone to record. I didn't have anything with me. And when I mean anything, I was looking around like, am I being punked? And I said to her, this stitch is scratching me. I can't. So she go in there, try to pull the tweezers, trying to cut the stitch and everything. So she can see that what I'm saying, this is pain. I'm having internal pain. And I said, so can you call me in a prescription? No, no. So I'm like sitting there stunned. And I was like, wow. And they had a sign on the wall that said, let us know if you're recording. If you're recording, you need to notify the doctor. Now, that should have been a red flag, because why do we need to be recording? And then I got to tell you that I'm recording. So I was like, wow. So, like I said, I'm sitting there dazed. I'm in pain. I'm thinking I'm being punked by the guy who used to do the punk show. And so she turns and walks out the room. So I'm just sitting there like, oh my God. I couldn't even call my husband and express what am I going through, because I left my bag in the car, my backpack, because my little friend be in the backpack. I got a wallet, I got all this stuff. So I didn't even want to carry that day. And my phone was in the bag. So oh my God. I get back home. I had to call my primary physician to ask the triage nurse if she could give me something for pain. I just had surgery 3.5 days ago. I'm in pain. My surgeon wouldn't give me anything. She said, Denise, say less. Go pick it up at your Walgreens. And if you need me to renew this prescription, let me know before it runs out and I'll renew it. It was over the holiday. This was over the Thanksgiving holiday because I had my surgery mid-November. So I was like, thank God. So she took care of me. But this is what I knew coming out of that. I'm not going to take this video over 30 minutes. I was so appreciative that she understood my pain. I went back to her office with my phone recording in my pocket, because I was going to capture this to, if I needed proof for my attorney. I'm legal shit. I got legaled up. Dempsey Robinson Smith. Okay. So I wanted her to understand how they made me feel like I'm some kind of drug addict trying to steal medication when I am in pain 4 days out of a two-inch surgery. Y'all know the story. So when I went back in there, and my phone was in my pocket, I got the video. I was recording the audio. And immediately I said to her, I didn't appreciate the way that you treated me. And when I first met you and I saw your condition, I prayed for you. I didn't judge you. Whatever she was going through, if it was Bell palsy, if she had had a stroke, I said, Lord, they say she the best. Let her hands be steady. Let her hands be good. If she finna do surgery on me, bless her, Lord. Keep her. I didn't judge you, but how now you and your staff are going to judge me and make me feel like I'm trying to steal medication? And immediately she heard me in that moment. She didn't hear me that other day, but she heard me and she apologized. She said, I'm so sorry, Denise, but that's not how I want to make you feel. You are valuable while you're recovering. You should not be have to go through this, in her accent. You know, no, you should not to be have to go through this. I apologize. I apologize. It is my fault. I'm sorry if this is how you felt. Okay, I'm listening to her. I'm still recording though, y'all. And she apologized and said that she apologized for how she made me feel. And I said, and I need to speak to your assistant, because while I was speaking to her on the check-in of this and I was asking her questions, she was turning her back to me, which is so disrespectful. Y'all know I don't do disrespect well. That's a trigger. So I need to speak to her as well and talking smart to me on the phone as if I'm trying to steal drugs. Pain medication makes me nauseous. That's not what I'm trying to do. When I told y'all I had a previous addiction, it wasn't concerning no pain pills. Okay, stay tuned for the story time. I'll tell you what it was. But it was not, has never been pain medication. And I've been through a lot. Okay, I gave Vicodin medication, flushed it, gave it back to the hospital. I'm not that person. So at any rate, she said, okay, we'll bring her in, Karen L, right? Okay, the doctor kind of chuckled like, like, oh, good luck getting an apology out of her, right? Bring her in here. So she came on in and I shared with the doctor, told her how I felt, what I was going through, what I'm doing. So she said, well, I ain't wasn't my fault. I was just saying what they had told me to say and da, da, da. I said, I looked at the doctor. I said, this energy right here is what I'm talking about. And I don't appreciate it. And you, ma'am, need to bring yourself under subjection. When you are working with the general public, you need to understand, even if somebody is criticizing you, if they're sharing how they feel with you, then you need to accept that and then adjust your behavior. Be professional. See, that's because I'm advocating for me, y'all, in the moment. Ain't nobody gonna treat me bad. And so she started, wanted to, kind of like Dr. Jackie, that fake crying when ain't no tears. Well, I was just doing what they told me to say. I was just saying what they told me to say. This is not even my ward. I don't normally work here. I said, I don't care where you came from, but when you meet the patient, you need to have respect and you need to conduct yourself with professional. Who? You need to have a professional demeanor about yourself and not being slick out your mouth. Because see, slick can mean slick. Okay. So then she went through that. I didn't feel it. But then, okay, but I apologize. I apologize. If you felt some kind of, I received that apology based on your behavior. Okay. So then she was about to leave the room, tried to be slick out her mouth. And then I had to check her before she left. See, here's what you need to know. Be better today than you were yesterday. And then that can help you be a better person. Okay. So now you guys see the history. This is the backstory. I saw a queen get assaulted by a Karen with a laptop when she was pregnant. Not a week later, I'm going through trauma and breast cancer. And then I went to my radiation. That was a wonderful team at the Cancer Care Center. I went through radiation. I had to get in there, check my doctor, okay? And then, and her Karen assistant. And now here come Dr. Jackie with your sad, and I'm gonna just call it like it is, pitiful ass, okay? Your pitiful ass is sitting out here, and I took a couple of talking about black women are dramatic and crying wolf. What the F? What the F are you talking about? And you're supposed to be an OBGYN doctor and had on there faking and funking with Kamala Harris. I got a conversation for you too, ma'am, because I haven't seen you, heard from you while hundreds of thousands of black women girls and boys are missing. Ain't heard nothing from you. But I digress. This chick out here talking about she gonna be the doctor advocate for women and the mortality rate for black women. The fuck? No, you're phony, and they need to remove you from whatever council they assigned you to. Excuse my language, but I'm gonna get real about it because I'm disgusted. And I'm titling this Dr. Jackie, in my opinion, is a disgrace. This is my personal opinion, okay? So you're sitting up here calling black women dramatic and crying wolf, and that 25 times during the pregnancy, they want to come in there. Ain't that what your job is as an OBGYN, to see the patients? How do you know what a woman's pregnancy is going through? And then if they listening to you, they wouldn't even come in and get treatment or get examined. This is why we have the highest mortality rate in the black community, you demon. In my opinion, you're a jackass and a demon. But let me continue. Now, you're gonna say they're just complaining to get time off work. How dare you? How dare you when something can really be going on with that pregnancy? And then, oh my God, they need to. I heard that you were infertile. I'm not trying to take a low blow here, but if you're infertile and then you passing this kind of judgment on pregnant women, could there be a correlation between that? That you mad because they pregnant and you can't be? Okay, this is just a thought. I'm just asking. I'm just saying. Okay. All right. Then I already talked about that when my issue and how I went through with seeing that queen being hit with a laptop. I got to do a follow up on that because you should have sued them, all of them, personally sued, and the hospital that you were in. Okay, now let's jump on over here. This is what then she gonna have this half-ass apology talking about, well, if I could take it all back, all I would say is that you should bring a buddy with you to the appointment. With them dry ass tears. No, you shouldn't have to bring a buddy to appointment. If you're the doctor, you need to be able to listen and respond when your patients are talking to you. But what I would say to the ladies, bring a notebook and a pen, an ink pen, and a notebook with you to the appointment. And before you get there, you write down your questions. That way, a doctor is not allowed to rush you out of your appointment. Because, see, they on the schedule. They getting their money. They going to run in and run out and run you off. No. But if you have your things already written down on the piece of paper, they don't get to leave the room until they answer your questions. And they acknowledge your pain and what you're going through. But this ain't no damn buddy system. You don't get to, everybody don't have a friend or somebody can take off work and be on the buddy system when they come to see their doctor. Your doctor ought to be respectful enough to understand and respect what your patient is saying, Dr. Jackie, with your fake ass. That's just my opinion. So now we dealt with that, but you must be your own advocate. That's how I found out that I had a brain tumor in my head. My mother was a registered nurse, took me through that. That's another story time. But you must advocate. Don't let them tell you got the sinus infection, or it's just some this, or you're not really in pain. You just, Dr. Jackie said, you're just trying to get a note off work. Well, if I need a note off work, oh, I almost said bitch, then I need you to write the note so that I can be off work. I don't need you questioning what my threshold of pain is or whether it's real. I'm experiencing this. This is my experience. Oh my God. Okay, so moving right along. The next point, like I said, how dare you? And you didn't even apologize with that fake ass apology. You doubled down with your BS. And we see you, we saw you. I'll never watch you again. So for that Married to Medicine, as long as they got you in there, I'm done with it. I would not watch it to save your life or your career. You don't even help women that don't have prime insurance. How dare you? You are a fraud, but you are perfecting with the vice president, with Sister Kamala. I hope she saw your fake ass and she released you quick. So, okay, with them fake. If you're going to cry, shed a tear, ma'am. Okay, I didn't accept it. You don't even accept the women. The White House chose you. That is a farce. See, instead of fuckery, I said farce. Okay, now wrapping this up, y'all. Just say my bad. I need you to bring your fake, disrespectful behind back on here and say my bad. That's what I did. I effed up. I didn't do it right. I doubled down. I look like a fool. And I don't deserve any patience. Patients coming out the woodwork talking about how evil you were, how you treated them. Say my bad. Sometimes that's what can help you and solve it. Okay? That's what you need to do because you took no accountability in what you said, and you ride in here same way with the rest of these racist, disrespectful individuals that think we still back in slavery and we ought to be able to endure pain. And until you get that straight, I don't want to hear nothing from you. I don't want to see your face. Okay. Now, your apology was weak. It was sick. It was sad. And you are a lie. And the truth ain't even in you. Okay. Because you don't know what women are going through. I can't even believe it. I'm so disgusted with you. That's why I named it. You're a disgrace. And that it's a bogus lie. And I say we cancel them until they get it together. If they feel the need necessary to bring her back, then we shouldn't be involved. And we as Black women always letting some slide. This is the year of accountability in the area of medical, television, politics, everything, finance. Everybody's going to be held accountable. Me, you, and them. All of us. Okay? So, like I said, I got a lot of business stuff coming, but before I get to the business, I need to air all this out and get this negativity off my chest and what I've been feeling. Okay? So you need to get it together, ma'am. My other cancer doctor, I had to cancel him. The damn bully. This was the after treatment. The radiation team was great, but the follow-on doctor, a bully. If anybody's a minute late, then he'll cancel them. Well, how about we sitting in the lobby waiting for you for 20 minutes? I canceled him. I don't want a doctor that's going to attempt to bully me. If you're going to bully me, I say farewell to you. They got a whole list. I went in there to Blue Cross Blue Shield. Praise God, I got insurance, and I will select me another physician. But I will not be bullied or intimidated by a doctor. So, ladies, all of you going through pregnancy, I wish you well. Get you a doctor that listens to you, and take your notebook and your pen and write down your issues, your requests, anything you're going through before you get there. Now, this chick, okay, I didn't call her a bitch. This chick is trying to tell you, oh, bring a buddy to advocate for you. No, I'm a grown ass woman and I need to be able to have my doctor hear me. So get a physician that's going to listen to you. But when you write these things down and you let them know what you are requesting, then hey, we got to make this rubber meet the road. We going to read at the crossroads, and this is what we're going to do. That's your right. You have a right to do that. Okay. So I'm getting out of here, guys. I know this went longer than I wanted to, but Dr. Jackie, mm, mm, mm. Until you do right by us, we say F you. That's how I feel about it. I'm gonna just keep it a buck. Okay. Hey, that's how I feel. This is my opinion, and that's what I feel. This is Mrs. Day all day. I'm out right now for real. I'm going to shut it down for the night. I'm going to hold this to tomorrow, but I'm going to get my husband to insert that photo of what my arm, and it'll be a trigger warning because it's a little side boob in the picture. But I'm going to let you guys know what I was going through with the surgery. And I thank God because I came through it with flying colors. After that 32 sessions of radiation, it healed up, but my boob was black, honey, and she had 2 deep scars in her, and ain't nobody gonna tell me that I'm not in pain and accusing me of trying to take pain medication. That's the last thing I need. Oh my God. But advocate for yourself, be encouraged, and all of you moms that are expecting a happy delivery, okay? But and I forgive me for going long, but I get passionate about things, and we are able to speak, advocate, and speak up for yourself. If your doctor's not in your corner, get another one. It's just like the same thing you go through. What did I have to if you need to do it, get you another one. Oh, with my realtor, when I was buying a house, if your real estate agent ain't working for you, get another one. Get next. And same way, especially with physicians. Next. Okay? Because you matter. and your pain matters. Don't let nobody tell you it doesn't. Look at that down there in Atlanta. It's Dr. Pull the babies decapitated a child. Were you in a rush? What school did you go to? How can you do that? Okay, so my point's been made. Bloop. Okay, I'm gonna put a period on it and an exclamation point. And Dr. Jackie, you suck. Okay, until you come back and do a real apology, I don't want to hear, see, or none of that from you until you're really apologizing. And don't come up on here with them fake ass tears no more, because that shit was weak. Okay, Dr. Heavenly, thank you for checking her halfway. But the rest of y'all need to rally around it because y'all whole show ought to be canceled if her face is still in there. That's just my opinion. Okay, and I got rights. I got a remote control and I got rights. Okay. Mrs. Day all day. I'm out and I'll see you guys later this week because I'm coming. It's getting ready to be some consistency. I'm coming for Brett Favre. I'm coming for these bozo, jackass, so-called politicians. Let's just give them a basic test. Do any of you know anything about law, the Constitution, anything? Got any decency about you? We coming in. Okay. Ciao. I am getting out of here because I know I've been all down and up and down this road, and I really hope I can. I know I contained myself because it could have been a whole lot worse for you, ma'am, and for the rest of them coming this week. This is the year of accountability, 2024. Let's be about our Father's business. Let's get it together. Okay, amen. I'm out. Mrs. Day all day. I'm out. Please go click and subscribe to my YouTube channel. I appreciate you.